We have the opportunity to be able to impact these children that are afflicted with the cancers. We partnered with the Barbados Cancer Society because of our mandate to give back to the community. We thought that it would be best to pick a reputable charity that was involved in improving the lives of people on a daily basis.
When they actually told us, your daughter have cancer, they looked at me and they said, you know, you're taking this so well. Do you understand? Do you understand that she's going to have to go through chemotherapy for a long part of her life? Do you understand that? And in my mind, I was like, no, she doesn't have cancer. She loves about anything. She actually makes play with anything. So she doesn't like really per se like anything in particular. She's very easygoing. She could play for a whole day. She could probably sit and watch television for a whole day. You know, it depends on, you know, what mood she's in at that point in time. For right now, I'm gonna say daddy's her best friend. She looks to him for comfort. She looks to him for everything. I'll be sitting right next to her and she'll pass me and go looking for daddy. So daddy's her best friend right about now.
The symptoms of childhood cancer is very non-specific, sometimes dependent on what the type of cancer is. So like with the ones that affect the bone marrow, they will have symptoms of bone marrow failure, which would include like symptoms of anemia where the child is pale, lethargic, or they may have symptoms of infections because their white blood cells are not working.
Me and my husband, we actually went around. It was December in 2016. We actually went to town. We actually wanted to go and do some shopping. So when we came back home, my mom said fell. So I was like, you know, it's normal for a child to fall. So I didn't really take much of it. But then when I looked at her, I realized that she had a bruise. I think it was down by her, it's around her tummy. It was just a small bruise. So I said I would just keep an eye on it, and if I guess if it looked a little worse or if she complains of any pain, you know, we would actually take her to the doctor. So I think it was like 2 days afterwards, I realized more bruising actually came up on the skin, and she didn't have another fall. So I was like, I don't understand, like, why is she getting more bruising? So we actually, daddy, because I was working at that point, I had to go to work, so daddy actually took her to the doctor. When dad took her to the doctor actually gave her antibiotics and told us that it may be some type of an infection.
They may have symptoms of bleeding, things like bruising, bleeding from the gums, and so they may have that because of their platelets, which are blood cells that help with clotting. So if the platelet count is low, they cannot clot, so then they have bleeding, but not massive bleeding that they will bleed out.
The fall happened the Saturday, so that could have been around the Wednesday when daddy took her to the doctor. So when she came back home and we started giving her the antibiotics, I realized that she was just like drying up. She was just not her usual playful, cheerful self. She was just drying up, and I was like, I don't know, the bruising. And then we kept seeing more bruising coming up on the skin.
As I always say to parents, is that you look for the persistence of these symptoms. So if a child is having these symptoms longer than 2 to 3 weeks, even if you go to a doctor and you're not getting the response that you would like, then you would either go back. I try not to do doctor shopping, but if you go back to the doctor and you're not happy with it, then you may seek an opinion, say from a pediatrician, because pediatricians are trained in knowledge of children and childhood symptoms.
When Daddy took her to the doctor for the blood test, the test results came back that her blood count was really, really low. Daddy called me at work. He was like, you need to come to the hospital now. So then when I get down to the hospital now, the doctors were like, we have something to tell you. And they said, we think may have cancer. It may be leukemia.
So this patient has what we call acute lymphoblastic leukemia, which is the commonest childhood cancer, and it makes up about 25% of all cancers in our region, as ours have said. This is one of the most treatable cancers, and it is research in this that we have been getting better and better, and this is where people using chemotherapy and so to treat children and adult patients. This was kind of the stepping stone.
We had a meeting about the treatment. So they explained that the type of cancer that she has, the obvious treatment is chemotherapy. So they actually explained to us that the chemotherapy is 2.5 years long, and that they were explaining to us the different side effects.
What the chemotherapy does is on all the fast or rapidly dividing cells in the body, and the ones that we have which would give you the acute side effects would be your hair, so that's why patients may lose their hair, the lining of the stomach, so that's where they get the nausea and vomiting, and then the bone marrow, where they get bone marrow failure.
One of the major side effects to her is that she would have actually lost her hair, but she still maintains a positive attitude, and she's very positive. She smiles, and if you look at her, she'll make you smile. Her smile is very contagious, and it could actually light up an entire room. This diagnosis has actually changed our life, because Daddy actually had to take a break from work, and he keeps our daughter during the day, and when she has to go to the hospital, he actually takes her to the hospital. So it's been a lot, and it takes, like, even now I'm still trying to adjust to the fact that it is cancer. But when I do look at my child, I still don't think of her as, oh, she's sick, or she has cancer. I try to maintain a positive outlook. For other families that are going through similar situation, it may not necessarily be cancer, it may be diabetes, it may be something else. My advice to you is that communication is very important, especially when you have to go to the doctor. If there's something that you're told that you're not comfortable with, there's nothing wrong with asking questions and getting a second opinion. Throughout this process, my husband has been my rock. He has actually been there holding everything together, because there are many days where I would have actually broken down and said to myself, I don't know how I'm going to get through this. I honestly don't know what I'm going to do. But looking at him and looking at the strength that he shows and the strength that he actually shows to our daughter, I'm very grateful for that.